Hi, this is Tanya Stansel, and we're going to discuss depression. First, a disclaimer. This video is solely for educational purposes. It is not meant to diagnose or treat any condition. Depression is a mood disorder that is also known as major depressive disorder or clinical depression. It is comprised of a persistent feeling of sadness and a loss of interest in activities. An individual has episodes of symptoms that fluctuate in severity. The episodes last at least 2 weeks, but can last for months or years. Symptoms of depression include persistent feelings of sadness, anxiety, hopelessness, and worthlessness, feelings of irritability or angry outbursts, loss of interest in activities, decreased energy or fatigue, difficulty concentrating, remembering, or making decisions, sleep disturbances such as difficulty sleeping, early morning awakening or oversleeping, appetite and/or weight changes, either up or down, aches or pains not explained by other conditions, increase in purposeless physical activity such as pacing back and forth, slowed movements in speech, and suicidal ideations or suicide attempts. 6.7% of adults are affected by depression in any given year. 16.6% of people experience depression during their lifetime. 16.1 million people in the United States are affected by depression. Women are twice as likely to experience depression than men, and about 1/3 of women experience an episode of depression in their lifetime. Risk factors of depression include genetics, as depression runs in families, brain chemistry, as differences in chemicals in the brain, such as neurotransmitters, can contribute to depression, environmental factors, with exposure to violence, neglect, abuse, or poverty increasing the likelihood of depression, psychological and social factors, hormones, personality, acute stress, lack of coping strategies, some medications, recreational drugs, head injury, chronic conditions, and persistent pain. Depression is most often first seen in adulthood, although it can be seen in other ages. In adults, depression can occur along with other medical conditions. Medications for these conditions may also impact depression. In order to diagnose depression, several things should be done, including a physical exam, lab tests, such as testing for thyroid hormone levels, psychiatric evaluations, such as depression questionnaires, and the use of the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. According to the DSM-5, 5 or more symptoms must be present during a 2-week period, as well as be a change in prior functioning, with one of the symptoms being either a depressed mood or a loss of interest in activities or pleasure. Treatments for depression include support from family, friends, and medical professionals, psychotherapy, medications such as selective serotonin reuptake inhibitors, or SSRIs, monoamine oxidase inhibitors, or MAOIs, tricyclic antidepressants, atypical antidepressants, and selective serotonin and norepinephrine reuptake inhibitors, or SSNRIs. Other treatments include electroconvulsive therapy and transcranial magnetic stimulation. These two therapies are used for severe depression or bipolar disorder that has not responded to other treatments. There are forms of depression that are somewhat different from major depressive disorder. Persistent depressive disorder is also known as dysthymia and is less severe but more chronic as it lasts for at least 2 years. Postpartum depression occurs during pregnancy or after childbirth. Psychotic depression consists of severe depression, and a form of psychosis, such as delusions or hallucinations. Major depressive disorder with seasonal pattern has an onset during winter months where there is less natural light. Bipolar depression fluctuates between depression and mania, which is an extreme high euphoria. Cyclothymic disorder involves symptoms that are milder than bipolar depression. If you are If you are experiencing depression, find support and seek medical attention. If you are considering suicide, find support, seek medical attention, or contact the National Suicide Hotline at 1-800-273-8255. Thank you for joining this discussion on depression. Please subscribe to our channel below, and for more information on depression and other health topics, please visit our Healthy Living blog at healthylivingforyourself.blogspot.com.